Hi guys, my name is Natasha Mueller and I'll be showing you how to do a venipuncture procedure. But before that, I want to show you guys which instruments you guys will need for the venipuncture. First, we have a hub. Then we have the needle, which is very important. Second, we have tubes, but it is very important to have two just in case they tend to roll a lot. So it's very important to have two just in case in emergency. We will also need a band-aid. We will need alcohol wipes. I tend to have more than one just to be safe. Then we also have gauze. I also tend to have more just in case. We will need a tourniquet and gloves. There you go. And last but not least, we have to make sure that we wash our hands, and if by any chance you cannot wash your hands, you must have hand sanitizer and sanitize your hands. Also, a very important thing when you're doing a venipuncture is to verify the patient. Make sure that the patient's legs are uncrossed. Make sure that the patient states and spells their name, and also states their date of birth. And by name, I mean name and last name. That is very, very crucial. You have to make sure that you have the right patient. Hi guys, we're here at the site. This is my patient Alex. Here I have all my supplies just like I told you before. We have the alcohol, the gauze, the tubes, the band-aid. We have the hub, the needle, the gloves, the tourniquet, and the patient. And then we also have, just in case, we have hand sanitizer, and we also have the sharps container. Right after we draw the blood, we can throw the needle in there. Alright guys, it's very important to, like I told you guys before, to ask the patient to state their name and date of birth, and to also spell it. So sir, can you please state your name and date of birth and spell your last name, your first and last name?
Alex Comas, and it's December 8, 1993.
Perfect. And can you spell your first and last name?
It's Alex, and then the last name is Comas.
Perfect. Okay, just to verify, can you not cross your legs? You don't have them crossed right now, but I want to make sure. And then also, are you chewing gum?
No.
Okay, perfect. Do you have any bad experience with venipunctures?
No.
Okay, perfect. Is there any arm you prefer?
The right one.
Okay, sounds good. Thank you. Alright guys, I'm going to go ahead and place a tourniquet. I don't have my gloves on right now because we're allowed to palpate the vein without gloves. Okay, as you can see, the vein is right over here. I can perfectly palpate the vein. I'm going to go ahead and let it go for now so I can explain something to you guys. These things are on my left because I'm my right hand. That way I can do the procedure and just quickly grab this stuff, and I don't have to cross-contaminate anything. Okay? So I'm going to go ahead and put my gloves on. I already sanitized my hands. I already palpated the vein. The patient already stated their name and date of birth, and also spelled their name. Okay, I'm going to go ahead and do the procedure right now. Alcohol wipe, already opened it. My band-aid is here at the corner just so it's ready. I'm going to go ahead and clean the site. And while the site is drying, I'm going to go ahead and open the needle. We're going to open the back of the needle, and we're going to put it on the hub. There you go. We're going to open the needle. I'm going to inspect the needle. Make sure that there is no anything broken or bent. I already inspected my needle, and I'm going to go ahead and anchor the vein and go in fast. Okay, and then I grab my tubes and I put the tube in. The blood is coming out perfectly. I will let go of the tourniquet, take out the tube, and I'm going to go ahead and grab one of the gauze, put it on top of the vein, take out the needle, close it, and then go ahead and throw it into our container. Okay, we can hold pressure, and then we're going to go ahead and fold the gauze, sorry. Make sure that we don't let go, and then we're going to go ahead and put the band-aid. Are you okay, Mr. Comas?
Yes.
Okay. And then last but not least, we have to make sure that we put the date of the day of the venipuncture. We put the date of birth of the patient and their first and last name. Well, those are things that you do at the end. Let's also not forget to invert the tube. That way they can do the test correctly. All right, guys, thank you so much.